this whole theory of access centers and support being under one roof to make it easy for a patient to receive the help for whatever they need when they walk in shouldn't be this mind-blowing theory.
Right.
It shouldn't, especially now. This just shouldn't. We should not in 2020 and 2021 be applauding ourselves for saying, do you know what we should do? Put everything under one roof and make it easy for people to get help. Like, this should not be where we are at right now. It is. So I'm glad we're doing something about it, but it's also extremely frustrating that we have to like pat ourselves on the back to be like, we put 4 providers under one roof. Look, we are leading this right here. Like that, that to me is still crazy.
Welcome back to You Need a Counselor podcast. My name is Julie Johnson. I am the president and founder of Heart and Solutions. We are a strength-based counseling agency here in Iowa. We are providing telehealth, mental health therapy across the state right now. So if you are in one of our 7 office locations, feel free to give us a call so you can get signed up for counseling in our offices. However, if you're interested in doing telehealth, where you can do that on the phone or on the computer without leaving your house or without changing out of your pajamas, definitely give us a call because we're serving anybody in Iowa right now.
I'm Chrissa Brown, and I am the Vice President at Heart and Solutions in charge of our behavioral health department. So we work with kids ages 4 to 18 in home, in school, on telehealth right now as well, or in the office on different behavioral skills. And this is our podcast, You Need a Counselor. So the mission of our podcast is that we are designed for people curious about counseling but have barriers keeping them from experiencing the benefits of counseling. Our mission is to share stories about counseling, good, bad, and indifferent, and spread the message that everyone can benefit from mental health and behavioral health counseling services.
So we post on Sunday nights at 5:00 p.m. So make sure you batch up all of your clean laundry to put away. That way you've got underwear and socks for the entire week. And we will be putting away our clean laundry with you on Sunday nights at 5 Central. So don't do that alone. Don't do that throughout the week. Like, why prolong the misery of putting away clean laundry? Batch that all up. Get it done on Sunday nights. You won't be alone. And you can listen to the podcast that also gives you the entire week to get scheduled with your counselor if you haven't seen your counselor in a while, or to get signed up to start counseling services. Oh my gosh, you guys, we have a very special guest today. So I want to welcome Erin Foster to the podcast. Welcome, Erin.
Thank you.
Yeah, thanks for being here. So I'm going to brag on Erin a little bit. So Erin is a graduate of the University of Iowa, and she previously worked at ASAC, ASAC, which is the Area Substance Abuse Council, and she was a prevention specialist there. And Erin is now the Mental Health Access Center Director for Linn County. Erin, can you tell us more about, because Mental Health Access Director for Linn County, that's a big title. Can you tell us more about what does this mean?
Oh, it's a new title, so we're kind of figuring out what it means as we go. So as you mentioned, I actually was with ASAC for about 12 and a half years. So I was in the substance use disorder arena for most of my professional career. And as you also mentioned, I was in the prevention. So I was kind of in the before, not the after. So we did a lot of work, policy work and micro level work, working a lot with kids and really trying to figure out, how do we get them to not go down this road, and what do we figure out with them, whether we're addressing like adverse childhood experiences or trauma, and giving them the information to make really good, healthy decisions for themselves. So you're not dealing with crisis down the road. You're not dealing with, needing to receive treatment as you become an adult. So I did a big switch December of 2019 and came to Linn County, was offered the position with Linn County. That was a brand new position. So it was exciting because no one had ever done this job before. And it was terrifying because no one had ever done this job before. So, a lot of times when you start new careers and new jobs, you have people that you can go to and what has been done before and what can we do and what can we continue. There was none of that in this position. Not only was there nobody in this position before, access centers do not exist around here. So it's a new position for a new program for the county that then, as you mentioned, incorporates other agencies. So there's a lot of figuring out as we go what we need to do, how we need to figure out, and how we need to coordinate it. So this was an opportunity of a lifetime to come to Linn County and do this. It has been difficult. I know we'll discuss more. You throw COVID into it, you throw a derecho into it, getting sent home from work 3 months into a new position and figuring out how to do this from my kitchen table with little kids running around. So it's been a year. We'll say that it is nothing at all what I expected to do. But it has been an amazing year, and I'm so excited to explain the Access Center to you guys and to people who listen to your podcast, because it is a very, very exciting project that I'm so happy to be a part of and to be leading Linn County through this.
Wow. Yeah, it sounds like, I mean, with COVID and all the changes that happened, it's a little more than a year in, but really with having to take a lot of breaks and Cedar Rapids area having the derecho storms. Oh my gosh, there have been so many disruptions this year in that area. And so a brand new position to start a brand new program in a brand new county that hasn't had that before. Oh my goodness. Like you said, usually you've got somebody who kind of has role modeled it, who's made the mistakes for you.
That's me now. I'm that person. Oh no.
You get to be the head guinea pig for every new process. Absolutely. Wow. So what is the mission of the Mental Health Access Center? What is the mission?
So kind of back up a little bit with access centers. So, we've mentioned a couple times here already, it's very new to this area. It's very new to the state of Iowa. We are fortunate that it's not very new across the country. These exist several different locations across the country. So although there's not a lot of people to turn to here locally for help and assistance, there are people across the country, and we're fortunate to have those connections already. But what the Access Center is really meant to do is, we know that there are those situations, both in mental health needs and substance use disorder needs, where it is a crisis. Something needs to be done right now. And other than emergency rooms and jails, there's really no good place for people who are in crisis in these two situations to go, to not only go and be de-escalated and talk with someone and talk through a crisis and figure out a safety plan and figure out what do you actually need right now, but not only what do you need right now, what do you need once you discharge, what do you need an hour from now compared to what you need 24 hours from now, a week from now, a month from now. And that's really what access centers do. They are a 24/7, 365. You get to determine what your crisis is. That's the other piece of our crisis center here is, we do not dictate. We do not say, no, that's a crisis. That's not a crisis, and this is a crisis. If you feel you are in a mental health or substance use disorder crisis, you come to us and we will help work with you and we will figure it out. So it can look very different for a lot of things. It can be something as simple as, I have never been able to put into words, but I think I have depression, or I think I have something that I need to talk to somebody. Here is my window to talk to somebody. I need to do it right now. Versus someone who has dealt with mental health or has dealt with substance use disorder for many years in the past, and they're kind of on the verge of, they know something is a little bit off and they want to deal with it right now. They don't want to wait weeks to get an appointment, or they don't want to wait weeks to talk to a prescriber if they're already on meds. So we can help start that new process with them right now. So it's very similar to an urgent care. If you have a child or you yourself has an ear infection and you need the medication right now, it is a very similar project or process to, if you're dealing with a crisis with mental health and substance use, you can come in right now and start the process of getting the help you need. more importantly, sometimes can be what happens when you leave here. So I think we do okay with physical help of you come in, you get medication, you leave, there's a checkup process normally afterwards. We don't do very well with that with mental health. If you come in, if you get the assistance that you need, then it's okay, we'll see you later. Maybe when you're having another crisis, and we'll deal with it then. The post discharge and the case management piece here is just as important as you walking in the front door with us. So it is kind of the all encompassing person first. What do we help you with right now? And then how do we keep you safe and keep you healthy even after you leave our doors? So it is a very different look to mental health and substance use disorder, not to mention the combination of services under one roof that we have ever seen around here before.
Mhm. Wow. And I love that, that distinction of, or that there really is a very loose definition of crisis, a mental health crisis or substance use crisis, because that word can mean so many different things to so many different people.
Yes.
And I love that you would not turn somebody away and say, nope, this isn't a crisis, because something that from the outside can seem somewhat benign, or it could seem like, oh, well, this isn't as much of a threat because maybe somebody's life isn't in immediate danger or immediate peril today. But that doesn't mean that couldn't change tomorrow. And I think that, the fact that you're coming from a prevention side of the coin really does speak to this, because on the front of it, it kind of seems like they're opposite, right? Like, I'm coming from prevention and now I'm going right into crisis. But I think that the ability for somebody to define that crisis themselves means that, okay, you're not going to have a situation where like, well, it's not bad enough for me to get help yet. And I think in this field, that is such a prevalent thought, that like, it's not bad enough yet. Other people have it worse than I do, right? Or it could be so much worse than it is right now. And so we just wait until it gets to that point, and then we have a different kind of crisis, So I love that we can extend that definition to say, yeah, that can just be that it's like a time sensitive situation too, right? When we've got depressive symptoms or we've got anxiety symptoms, something can happen, and if we've got strong coping skills, that doesn't mean that we don't need help. And so sometimes something happens, we go, okay, yes, I do need help. I want to get help. But then by the time we get help, those coping skills that kind of mask that pain or block those symptoms have kicked in. They've had time to kick in. And now we come in and we go, well, it's not really that bad. Right? We minimize our own pain. We minimize our own suffering sometimes. And I love the idea that somebody could come in and immediately get treatment when they need it, when they've got that drive to need it, and that openness to help. And tell me more about that in terms of substance use disorder, because I feel like I can conceptualize this, and I see such a benefit in the mental health side. But tell me about the substance abuse disorder side.
Right. So I think one of the most interesting pieces of the Access Center, specifically coming from the substance use side, is I don't think there would be anyone who is educated in mental health and substance use disorders that would not say that there is a strong connection between mental health and substance use disorder. And I think in the state of Iowa, when they are divided statewide from the different departments who oversee it, that becomes an issue for people trying to get both services. You have mental health being overseen by DHS. You have substance use disorders being overseen by Department of Public Health. And we know there's a connection. I think anyone in the field knows there's a connection. But when you have two different departments overseeing, the blending, the treatment being done in tandem can get messy. And so you have someone who can, describe themselves as someone who has a mental health disorder and a substance use disorder, which many people can, put themselves in both of those categories. When you have the non-blending of the services happening at the state level, it's very difficult for patients to navigate this already difficult system and then try to themselves blend the two departments and figure out, how do we work together? How do we do this? So when you're talking about an access center, and one of the biggest pieces of why it's going to be successful. And I'm not saying that just to brag on us, but literally thinking this is why it's going to be successful, is because it puts all of these different providers, all of the different services under one roof. It takes the difficulty of figuring out the mental health and the substance use disorder system out of the hands of the patients that are in crisis. It shouldn't have to be them or their loved ones figuring out how do we maneuver this. And so when someone comes into the Access Center, regardless of what they are telling us their crisis are, we have kind of a workflow. We have a process that we follow. So to kind of understand the substance use part, you also need to understand the entire piece of what happens when someone comes into the Access Center. So someone walks in our front door, and I will discuss a little bit different way in which someone can come in, which is with law enforcement. Law enforcement is actually one of the biggest referral sources to an Access Center, but let's take that out for a second. Someone walks into our front door, it's 100% voluntary. So either they come with a loved one or they come on their own, and they present to us at the Access Center. Everyone who comes in meets with a Foundation 2 crisis counselor. So it would be very similar to if someone were to call mobile crisis on scene. The only difference is you're coming to them instead of them coming to you. So we do triage, and the crisis counselors do triage. And what they're really doing is having that discussion with the patient of what brought you in. There is no judgment as to what brought you in. There is no digging into what we discussed before, like, well, this isn't really a crisis. Why are you here? It's really that let's sit down and have a conversation. Something brought you in. Someone brought you here to us. There are some screening that we do, obviously with COVID. There's some vitals that we take. There's some different physical health pieces that we do need to discuss, because if someone does present to us with an actual physical medical issues, we are not equipped here to handle those. So if someone comes and their vitals are kind of all over the place, it can tell us that something else may be going on, and we want to make sure that patients are medically cleared to stay with us. So we do take vitals. We're also doing screenings like brain injury screenings. Suicide risk screening is a big one that we do on patients coming in. But literally that triage is just, as I mentioned, it's why are you here? Why did you want to come see us today? With that triage, then it opens the door for the crisis counselors and all of the other providers to work together then to figure out what is best needed for that patient at the time. A good bulk of patients that come into access centers across the country, anywhere from 70 to 80%, actually get everything they need. They get their crisis de-escalated, they get connected to services, they get connections to care coordination right there in that triage hallway. So it really isn't even a bulk of people that stay with us that have those more 3 to 5 day stays. If they are in need of services, as I mentioned, we have a variety of different services right here. It's literally a walk down our hallway. We have services such as crisis stabilization, crisis observation. Abbe Community Health is literally next door to us, so we can make connections for them to get a psychiatric evaluation, to see a prescriber, which again, those things could potentially take months to do. And then, as you mentioned, the substance use disorder piece. Here at the Access Center, we will have a sobering unit. So we will literally have a unit where people who are intoxicated can come and stay with us for less than 24 hours, get sober, and then have that conversation of, you did find yourself in a sobering unit at the Access Center. Let's dig in a little bit to figure out why you're here, what you need. Not everyone in the sobering unit is going to need treatment. We know that, but at least there's a conversation about that. You have a conversation with triage staff. You have a conversation with an ASAC staff member of, do you need something? What can we help you do? We also have a medical detox unit here. So kind of the step above sobering. If someone is looking to start treatment, a lot of treatment agencies do require that you are detoxed from the substances that are in your body at the time. And detox services are very hard to come by around here. So we'll have a detox unit here. All of those, sobering unit, the detox unit, then is kind of the board that one can jump off to get connected to treatment services if that's what they need. So a lot of times the services here are the initial triage, evaluation, assessment, and then the hope is we help you get connected to inpatient, outpatient, whatever that looks like, in order to come up with that discharge plan and then the connection to the other services. So as I mentioned, the discharge connection to other services is just as important as you walking in the front door, because people really do only stay with us 3 to 5 days max at the time. So 3 to 5 days, a lot of things can be figured out, but we know it's not the end. We know people need more than 3 to 5 days to really start their journey on recovery or start their journey on figuring out how to live with their mental illness. And we can be the start of that. And then we can also do the post-discharge work, the care coordination work, to get them to stay connected to the services that we helped them start with. And we helped them really meet with and discuss with an ongoing counselor that they can continue.
Wow. I love that, because I think that sometimes with mental health diagnoses, and it sounds like with substance use disorders, there is such a barrier there between, okay, now I think that I might need a counselor, and what do I do? How do I even get that? Right. And so the process of like Googling that, right. And then calling all of these different places and getting put on waiting lists and getting put on, and then, yeah, I might say, okay, well, maybe I've got a substance use disorder. Maybe I'm using a certain substance, let's say alcohol. In a way, it's because when I'm drinking alcohol, I am my mental health symptoms, right, feel better. They feel I don't experience them as severely. And so that's maybe why I started using alcohol for that. But then, if I am a person who is allergic to that alcoholic substance, I am going to have that craving for now that alcohol, even though it maybe now it's not helping me feel better with my mental health symptoms. And now I've got two issues, right? So starting out, I mean, it's kind of the chicken and the egg, right? Which comes first and which comes next. And, difficulty with being able to find prescribers in this state, and difficulty with getting on the correct medications, I think creates more of, but when I use this substance, my anxiety feels lessened when I'm using it, right? But then that substance causes me more issues, and now I've got more anxiety. And it's just that cycle. And I love what you're saying too about, I have generalized anxiety disorder, and that causes me some pain. And then I've got, maybe I'm using marijuana, right, to feel better about that, right? And so I might say, well, the marijuana is causing me some issues, right? Like I'm having job performance issues, or I'm having family issues because of it. And so I might say, well, I'm going to go get treatment, right? Substance use treatment for my marijuana use. But then I'm kind of in this portal, and mental health is over here. And mental health is the reason I started using it in the first place. And so then I get into the point where I go, okay, well, I'm not using the marijuana anymore. So maybe those, the troubles that I was having because of the marijuana use, maybe those are cleared. But I've still got the anxiety problem, right? So I'm back to square one.
It didn't go away.
No, it doesn't go away. And so, we're a mental health counseling agency. So we are, like you said, we're governed by DHS, and we have several counselors who are CADC, international CADCs. And they're so limited here in terms of what they can do. And they've got the skill to be able to do treatment for substance use disorders, but they're so limited. And we looked this up, how much you can be fined as a mental health counseling agency if you try
to be preventative.
Yes. I mean, oh my gosh, we were like, we want to help people, but we don't want to go to jail, right? Like, and you can go, it was like up to 3 years in prison. I'm like, I'm not going, right? So, but those barriers are so strict, and they're so imposing that it really does limit mental health clinicians from being able to provide support when it comes to substance use disorders.
Right.
So
and it just doesn't make sense. Like that does not make sense in the world of helping patients who are coming to you saying, I don't know which one came first. Yeah. I know I have anxiety. I know I smoke marijuana. One sometimes makes me feel better. If I smoke marijuana, sometimes I feel better for my anxiety, but sometimes when I smoke marijuana, it makes my anxiety worse. I don't want any of that anymore. And you have some providers will say, well, come here, I'll help you with the anxiety. And you have the other one saying, come here, I'll help you with the marijuana issue. And the patient is stuck and insurance is stuck saying which one is primary and which one is secondary. And then if this one is secondary, well, we don't have to cover that one. And that's if someone has insurance. And we could do an entire podcast on the billing and reimbursement of both of these as well too. But again, it shouldn't be the responsibility of the patient or loved ones to navigate that system. The system should be in place to help people and create access, not create barriers to people getting treatment. They should, this whole theory of access centers and support being under one roof to make it easy for a patient to receive the help for whatever they need when they walk in shouldn't be this mind-blowing theory. It shouldn't, especially now. This shouldn't, we should not in 2020 and 2021 be applauding ourselves for saying, do you know what we should do? Put everything under one roof and make it easy for people to get help. Like, this should not be where we are at right now. It is. So I'm glad we're doing something about it, but it's also extremely frustrating that we have to like pat ourselves on the back to be like, we put 4 providers under one roof. Look, we are leading this right here. Like that to me is still crazy. It's still just, you leave your head shake your head leaving work sometimes thinking, man, we had a really good day, but why is this the bar that we're at for a really good day with how we're helping people? And that can still be extremely frustrating.
Absolutely. I mean, the image that comes to my head is like, if I'm going to have a grill out on the weekend and I want to get some hamburgers and I want to get some hamburger buns also.
Yep.
And if I had to go to if I had to go to the meat store for it, and I had to go to the bun store and the in the condiment store.
Yes.
Right,
and not only do you have to go there, the bun store is mad that you went to the meat one first. Yes. And the cashier is saying, we're not going to let you buy these. You need to come back tomorrow. You cannot purchase them on the same day.
That's right.
You need to come back tomorrow.
Absolutely.
It doesn't make sense.
No.
It doesn't make sense. But here we are. This is where the bar is. We're excited. We're excited that it's being raised a little bit, but it is still extremely frustrating that this is where we're at right now.
Yeah. Wow. And so it's so interesting to me too, because I think that, for me, when I think about an access center like this, or when I think about crisis intervention, the fact that you said that most people coming in get service that same day. Like they come in, they get their plan, they get connected, and they walk out of there that day. That's amazing to me, because it really can help people to utilize that motivation that they have, and knowing like, no, I don't need to go into the ER. Like, the ER is so expensive. Oh my gosh. And as a mental health provider, a lot of times it's the only place we can refer people so that they can be safe in those situations. And so this is really, really great. I love on the substance use side too, that you have the medical facilities ready to go so that people can have that conversation after the substance has left their body, because I think that a lot of times people still having those substances in them, whether it's narcotics or it's alcohol or whatever it is, and then trying to have a discussion about treatment, you're talking to substances. Like, you're not talking to the person who wants to recover. So wow, I love that. There's so many different options. And the assessment is just that simple. It's what brings you in. Tell us about what's happening.
What can I help you with today?
And then you guys follow up then. So you help people to get connected with the services. And then what does that follow-up look like? What kind of relationship does somebody who maybe came in January, what kind of relationship do they have with you guys in March or April?
So one of the questions we get a lot is, what happens if someone comes in, they work with us, for a day, or even if they stay for a couple days and something else happens, can they come back? Like, of course they can come back, because it may be a different crisis then. It may be something else. The root cause may still be the same, but they may be dealing with something different at the time. So there is not a quota for the number of times people can walk through our doors and receive services. But that follow-up piece is to work on that piece, to make it seem like when you leave here, you have a plan physically in your hands of when you are feeling like this, yes, our door is always open, but here's some other things in place. And that can look as simple as your plan can be a next day appointment next door at Abbe. Your plan may be if, let's say, you are dealing with mental health disorder, but you're also food insecure, or you're dealing with housing issues.
Yeah.
And that's actually what triggered your crisis. The foundation, again, could be a mental health or a substance use disorder, but what puts you in crisis is you don't know how to feed your children. You're food insecure. You don't have housing. Parenting in general. I'm a parent of 2 little kids. That can happen. So not only are we addressing let's figure out a plan for, how do you mention coping skills? How do you use your coping skills that you may or may not already have? But we're also going to connect you to HACAP. We're also going to connect you to Waypoint. We're going to make some other referrals to Willis Beatty, to all of the other organizations that have been such good partners in this that physically aren't here in the Access Center. Because again, we're not dictating what people's crises are.
Yeah.
That also means we're not dictating what triggered the crisis. What is it that puts you over where you're just like, I need help. I need to talk to someone right now. I need someone to help me brainstorm. How do I get into that? So that, again, that post-discharge, yes, it's a safety plan. It's to make sure that you don't feel like you are in crisis anymore, but then what's in place so you also don't have that triggering factor anymore. So we will do follow-up. We'll do 24-hour follow-up. And then how we do it is depending on which agency discharged the patient, they then follow their discharge policy. So the beautiful thing about this operation is it is a Linn County program, but there are 4 agencies in here doing the services. So when we write policies and procedures, it has been fun to figure out how do you then put together really 5 entities, because you have Linn County in there as well, worth of policies and procedures. So there are some that we have just decided if they are your patient. So you come in, do triage, and then through triage, we realize that you can receive services from ASAC. You then become an ASAC patient. So then ASAC's post-discharge and follow-up care coordination becomes part of your plan. So then it is ASAC doing the post-discharge with you. Knowing that they're your patient, you probably worked with them, you worked on the rapport with them, and it's not just someone random picking up the phone and saying, "Hey, Erin, how you doing today? Is there anything else we can help you with?" It's the agency that you built their relationship with here. So that important piece of bringing all other agencies in here as well really makes this program stronger, and we will continue to reach out to other agencies. So I'm a big data geek, and we are collecting a lot of data on patients that come in here. Again, new program, you need to look at everything. But one of the most interesting pieces to me is going to be, who else are we making referrals to? Who else are we connecting people to when they are here besides just the 4 that are here? Because if we are continually making referrals to Waypoint or continually making referrals to Willis Beatty or HACAP, it makes sense to bring them in here with us then. It may not be a 24/7, but if we're figuring out that a lot of our patients don't have primary care physicians, and we know we can make referrals to Eastern Iowa Health Center, it makes sense to have them here certain days of the week to be providing services here. So what I kind of refer to as wave 2 of the Access Center is really looking at, there's also access, or there's also barriers to other services that we know. How do we work on those as well? Because we're working on a holistic approach here, the entire person. And if we can knock down some of the barriers on the mental health and substance use disorder side, we also should be able to do it for other things. And again, the community collaboration around this project has been amazing. And it has been so exciting to go to someone and have them say, "We saw this on the news, we read it in the paper. How do we be part of it too?" And I love that community piece work. It is part of the prevention work that I absolutely loved probably most about my job. And so to get to continue to do that here has been very exciting for me.
Wow. I mean, it's a wonderful program, and it's a wonderful idea. And like you said, it just makes sense. It just makes sense to have everything kind of together. I mean, if shopping malls can do it,
Exactly.
like you have your little food court and you've got your little clothing stores. And
I mean, Target, think how Target puts Starbucks with shopping. They know how to do this. They know how to do it. We can do it too. We're smart too.
I love that you also, it doesn't have to be necessarily even what might be typically defined as like a mental health crisis or a substance use crisis. If it is, I am having thoughts about my kid, like harming my kids, right? Or I'm having, but even if you're like, well, I'm having these thoughts, but I know I can control, and how we minimize again.
Exactly.
And this service just really allows somebody to go, yeah, but I'm having the thoughts, so I'm still going to go and get connected and
I can go right now. I feel a lot of times, when we have those thoughts and we're second guessing ourselves and we're trying to figure it out, it's not an 8 to 5 thing. That's not how that works. And even if it was an 8 to 5 thing, sometimes you're calling an office and you're not actually getting to talk to someone. The fact that if we're having those thoughts when we're getting ready for bed, when it's late at night, and you're like, I will do something if I can talk to somebody right now. We're here right now. That's the point of it. From the substance use world, we always talk about, you got a couple minutes when that window is open to really talk to somebody about what their future can look like. The window is always open here. Those couple minutes can be right now, and we can at least start the discussion as to what you need right now.
Absolutely. Yeah. And so you're open 24 hours.
So that's the fun part. We're not fully open right now. So, we currently right now have our crisis stabilization beds open. How someone utilizes them right now is they actually come in with mobile crisis. So it is a call that mobile crisis goes on. Mobile crisis has worked with Penn Center on their procedure to bring people in here for our crisis beds. So we're doing kind of incremental opening, figuring out how we put all these places together. In the very near future, and there will be a lot of media about this. Everyone was kind of sick of seeing my face and listening to me talk about a month ago. They're going to see me again real soon. In a couple weeks, a week or so, we will have daytime hours. So we'll be open kind of that 8 to 5, 8 to 6 walk-in, starting to add more services to it. If it's after that 5 or 6 o'clock, again, mobile crisis is the way in which you can get connected to our services. So we are going to keep gradually adding on services, adding on times to the point to which we are 24/7. So currently right now, we are not 24/7, but if you are ever in need of these crisis services and you need to talk to someone right now, Foundation 2's mobile crisis is the way to get connected to us and the way to get started on this process. They are the gatekeepers at our front door. And in general, that service is not changing. This is an additional service to them. And so they are the ones who can answer that call 24/7 right now.
Perfect. So Foundation 2, the mobile crisis center that's been around, that people are familiar with. And now, and
please you guys use them. They are great.
They're wonderful. And then you guys are kind of adding on this, that next step, right? After somebody calls, gets connected with them. We work a lot with them on the JFAS mental health stuff. So we work with them. They'll give us a call and say, hey, what do you have in the next 24 hours? And then we can get people placed for mental health assessment within that 24-hour and get started getting people support, which is just wonderful. So, so ultimately you guys will be open for walk-ins in the next month or so here.
Yep. And that's the important piece of the Access Center that we're really trying to get the word out is you do not need to be referred to the Access Center. I try very hard not even to use the word referral in other sources because we don't want people to think they have to go to their primary care physician. They have to go to the ER first. Like Access Centers are large ER and jail diversion programs. The point is you don't have to go there to come here. So it is a walk-in facility. You don't need to call us if you want to, and you want to have a conversation over over the phone with someone, absolutely, but you do not need to do it. It is a walk-in facility.
I love that. It just takes one of the barriers away again, right? You don't have to call, you don't have to schedule an appointment. If you're free and they're open,
you
let's
can
just go walk right
Happy
in.
to see you.
Yes, that's wonderful. And people can call in also and get the same kind of planning services over the phone.
So that phone call will probably be more just let's discuss, let's discuss a couple things. More than likely, they're going to say, come on in, let's chat. Like, let's, come on in. We got a triage room open for you. We got services here. So that phone call would probably be more as a ease, like to ease people into coming in and feeling comfortable, but they would want to see someone in person. Come on in and let's chat about it.
Okay, great. Wow, very exciting to have this service here in Linn County, and being able to get people kind of just more connected with different services and take some of the mystery out of those services. With mental health care too, gosh, that is such a stigma. People think that like, well, I have to then go, if I have insurance, I've got to go to a doctor. I've got to schedule that. I've got to pay a copay, and just for them to say, yeah, you can go see a counselor, right? And we try to spread the word all the time. You don't need a doctor referral. You can call yourself in, and for here, you can walk right in, so you don't even have to make that phone call step in the scheduling step. So that is wonderful. Wow, how exciting. So we'll keep everybody posted, and it would be great to have you back in a couple months so we can kind of get the updates as
absolutely
you guys get
I
open.
would love to.
Yeah, I love that. Okay, so Erin, if you could give a suggestion to somebody who might be on the fence about maybe like counseling or getting treatment for substance use disorder, or even like just coming into the Access Center, what suggestion might you give them?
I think because this program is voluntary, we have so many services under one roof, we have so many ways to connect you to things, to just as we discussed before, to not think that, oh, my crisis isn't big enough, or it's not important enough, or someone's going to think it's not really a crisis and I'm just being silly about it. If you are feeling a way in which you need help with someone, come see us. Walk into there's going to be no one here that is going to tell you your crisis isn't that important. We really can't help you. You're being silly about it. We would love to see you. We would love to help you. We'd love to sit and figure out what we can do to help you. So make the first step. Or if you are a loved one of someone who's going through something, talk to them about how this is a welcoming environment. This is someone, this is a place where we have staff here that are not going to judge you. It's just a place to come talk and figure something out. There is nothing wrong with discussing additional needs and things that you can have in your life, additional supports, appointments, whatever it is. We can help you do that. We have the means to connect people. We have the partnerships to connect people, and we do it in such a welcoming environment that we are going to love seeing and helping people come in here. So please come see us. It's our point, our mission is to make it easy for people to get the assistance that they need.
Yeah. Love that. I love that somebody can come in not even knowing what services they want. And they can just say, this is what's happening. Here you go. And you guys
exactly. And that's the other point. We talked about the difficulty with mental health and substance use disorder and navigating that. There's a lot of resources here in Linn County that you may not even know exist. You may not even know that there's an agency out there, or you may understand, or what you think you may understand what a certain agency does, but we have such good connections that we understand a little bit deeper in which they can help, and different opportunities that are out there. So let us help you do that. That is our job. That is what we love to do. It's kind of a puzzle for us. We like to put the pieces together. We like to take the difficulty of someone being in a crisis and help them figure it out, to which they can sustain it then on their own. It's never going to be us saying, you need to do A, B, and C, and then you're going to be fine. It's going to be suggestions. It's going to be, have you thought about this? What do you think about us connecting you to this service? And really patient-centered driven, because as we try to hit home a lot, this is a voluntary service. If you don't want our help, if you don't want that referral, that's fine. We're here to help you. need in order to be successful.
Yeah, I love that. Options. Just gives people options.
Yep.
Yeah.
Absolutely. Choices that they could make and go from there. We talked about people being fearful that they can not come back to us, and that's not an option too. If there's a situation in which we give you a referral, we make a suggestion for contact a certain agency, and you come back to us, it's also not going to be held against you if you didn't do it. We may have a conversation and say, was there barriers? Was there something else that we can help with? Because there may be transportation barrier, there may be daycare barrier.
Yes.
And again, we can help work that. So there will not be situations in which you should ever think, well, I went to them and they helped me, but I didn't follow through, so I probably shouldn't go back to them. That's not going to be the case either. Every time you come in is a new situation, and we're going to view it as that and help you with what you need right there in the moment.
Yeah. I love that. That's wonderful. Well, Erin, thank you so much for sharing all of that information with us about the Access Center there. I mean, this is very, very exciting. And I'm glad that we get to have you on the podcast to explain about it, and then as you guys open and these services become more available, and COVID starts to kind of less of a barrier, we will, we're excited to kind of see as how all of that progresses. So
absolutely, I would love to come back and talk about how successful we are.
Yeah, that's how there you go. We like those updates.
Yes. I'm Erin Foster, and I need a counselor.
Awesome. So do we, by the way. I love that. Well, thank you so much, Erin, for being here. This has been really, really informative. And also, it's just great to meet you.
You too.
So just if you are in Iowa, any location in Iowa, we do have in Linn County area, we do have an office located in Cedar Rapids. We also have an office located in Marion. So if you're looking for in-office support in those areas, definitely give us a call. Or if you are located near one of our other 7 locations, let us know. Also, if you're in the state of Iowa, but you're not close to one of our locations, give us a call, because we'll do telehealth sessions with you over the computer or over the phone. You can call Heart and Solutions at 800-531-4236 to get started with mental health counseling.
And like Julie mentioned at the beginning, we post every Sunday night at 5 Central. So save up that laundry, do your laundry with us, listen to the podcast Sunday night, and get ready to call your counselor that week to get started with services.
Yeah, if you've got questions for us about counseling in general, or if you've got questions for Erin, then please send us a message either on Facebook at You Need a Counselor Podcast, or you can send us a DM on Instagram at You Need a Counselor Podcast as well. We will keep those questions confidential, but we can answer them on the show, and we can ask Erin to come back and answer some of those questions for you as well on the next episode.
I'm Chrissa Brown.
And I'm Julie Johnson, and we need a counselor.
And so do you.
Bye.
Bye.